Hi, I'm Dr. Eileen Sables, and today we're going to talk about polycystic ovarian syndrome, or PCOS for short, PCOS. So polycystic, poly means lots of, cystic means fluid-filled sacs, and this is what you see when you look on an ultrasound, lots and lots of little fluid-filled sacs in the ovaries. There should be some fluid-filled sacs because that's how you ovulate. So you get a little follicle which develops into a little cyst, it ruptures and out comes the egg. However, if you have lots and lots of cysts, then you produce a lot of estrogen and a lot of testosterone. And this gives rise to the symptoms that girls have with polycystic ovaries. First thing would be reduced numbers of periods, and some girls will have no periods at all on it. Increased hair growth, usually in male areas, so on the face, on the neck, on the front of the chest, around the abdomen, around the belly button, and increased acne as well. Weight gain around the middle, again in a male sort of area, and also reduced fertility. Often the first clue following puberty would be that your periods do not settle into a regular pattern, that they're very erratic, and there can be big gaps between periods. As doctors, the thing that we worry about with polycystic ovaries is that it's actually a metabolic disease. So it increases the chances of insulin resistance, which means you've got a higher chance of developing diabetes. It also means that you have a higher chance of developing a high cholesterol and developing heart disease. So we're pretty keen to be treating that. There's also a slightly higher risk that you could develop a cancer of the lining of the uterus. Obviously, this takes a very long time to develop, but we do have to just be aware of that. And there's also a reduced fertility in ladies who have polycystic ovaries. There is no cure for this, but it can be managed. Obviously, the thing that tends to upset people is the weight gain and the excess hair growth. So most females, that's what they want to be treated first. And you can use the contraceptive pill, which has a particular kind of progesterone in it, which is anti-testosterone. And it competes with the testosterone 4 receptors, so it reduces your chances of getting the hair growth and it reduces your chances of getting the acne and the weight gain. So we tend to use those pills. And also there's a drug called spironolactone, which is actually a water tablet, and that actually makes the hair growth much, much finer over a long period of time. So these are things that you can do initially. Once you are thinking about getting pregnant, we want to be trying to restore your periods to monthly if we can, and a diabetic drug called metformin can do this quite efficiently. So we would think about using that. Looking further down the track, if it takes you a long time to try and get pregnant, we're aware that you've got polycystic ovaries, then we will be referring you on to a gynecologist to talk about that. And from your point of view, 3 things that you can do to help your polycystic ovaries: good diet, plenty of exercise, and don't smoke.